I'm going to take you through, initially, just a quick revision on how we measure health inequalities in Scotland. I know there's a lot of people who are fairly new to this today, and then I'll spend most of the time talking through what we already know about what works to reduce health inequalities, and importantly, what doesn't work. In case anybody needs reminded, health inequalities matters. Martin Luther King said that of all inequalities, injustice in health is the most shocking and inhumane. And who can disagree with that? Obviously, the loss of life in Glasgow and across Scotland due to health inequalities is massive, and it's preventable, and so therefore it demands our attention. Fortunately, in Scotland, we have an excellent annual report produced by the Scottish Government, which monitors our health inequality trends, and we monitor a whole variety of outcomes, from premature mortality, mental well-being, first heart attacks, heart disease mortality amongst adults, cancer incidence, alcohol first admissions, alcohol deaths, mortality among young adults, low birth weight, and healthy birth weight as well. So we monitor all of these outcomes in Scotland every year, and so we've got a really good picture, a very rounded picture of what's happening with our health inequalities. I'm going to pick just one of these trends to illustrate some of the measures we use to say whether health inequalities are getting worse or better. Oh, I'm sorry, self-assessed health as well, and limiting long-term conditions. I had originally said that all of these would come up at once, but I failed in my PowerPoint skills today. Okay, so I'm going to pick one of them, which is mortality rate for those aged under 75 years. It's a really good measure of health, because we know that in the best countries across the world, the life expectancy is well above 75 years, and so this is very attainable. So it's good news on average. So from 1997 to 2015, you can see that mortality rates have gone down for this group over time, pretty steadily until the last year of data there in 2015. So that's good news. But that, of course, masks the inequalities across Scotland. So if we take the most affluent group, that's that blue line there, you can see that the most affluent group enjoy a mortality rate that's roughly half the average. Okay, so that's the most affluent tenth of the population, has a markedly different mortality rate than the average for the whole of Scotland. And what I'm going to do is just add in each tenth of the population now, and you can see each tenth of the population has a slightly higher mortality rate until you get to the most deprived groups there, and look how much higher the mortality rate is over time. Mortality rates are coming down in all those groups. By and large, they are quite bumpy because it's smaller sized populations, but the general trend is downwards. But that inequality, the gap or the ratio across those groups is largely maintained. And I want to talk a wee bit just about how we measure that so that you can understand what it says in this annual report on health inequalities. So if we present the data in a slightly different way, this is just taking the 2015 data and ranking from the most deprived to the least deprived on the left. You can see that very stark gradient of higher mortality in the most deprived groups is there. And what we do is we draw a best fit line. So the line, a linear straight line through those points. It doesn't exactly match each of those, so it's a best fit. But that's the kind of gradient across the population. And that's important because it doesn't just look at the worst and best. It takes into account all of the groups across the whole of society. And that's also important because even if you're in the middle, so if you are sort of in the fifth decile, the fifth group in that line, you can see that your mortality rates are higher than the most affluent group. So health inequalities affect everybody in society, not just the people at the extremes. Now, what we do is to measure the absolute gap, what's called the slope index of inequality. We draw a line across from the top and bottom of that red line. So you can see it's not equivalent to the highest mark, it's not equivalent to the lowest mark, it's looking at that best fit line. And then we measure the distance between those two lines, and that's the slope index of inequality. That is the absolute inequalities, the gap across the population after taking into account the slight variation across deciles. So that's quite important, and that's one of the headline measures we use in Scotland.